One of the common questions I get as a doctor is, what kind of supplements can I take? Are there any other natural things I can explore? And most of the times, we don't really have answers to that because if it's not really tested and trusted or evidence has not shown it, we are sort of hesitant to recommend natural sources. But I got you. So I've put together some common ailments, really centered around women, and some supplements or vitamins or tea that you can try while you're still taking your normal medication. So let's go. First on the list is PCOS, polycystic ovarian syndrome. So if you don't know what PCOS means, go to my last video and you will hear all I've said about it. So myo-inositol is a food supplement recommended for people who have PCOS. Anybody can take it. There has been some evidence to show that it improves the menstrual cycle and you can get regular periods while taking myo-inositol. There's also evidence to suggest that it improves insulin sensitivity in the tissue because PCOS is a complex endocrine disorder, and most times what you would get is the tissues become very insensitive to insulin, and that's the reason why testosterone gets even more produced in PCOS, and it can also lead to other conditions like diabetes mellitus and pre-diabetes. Okay. Number 2, painful and heavy periods. So if you're someone who suffers from painful and heavy period for any reason, you should try raspberry leaf tea, not raspberry tea, raspberry leaf tea. It's been shown to help with the painful periods, heavy periods, and bloating. And also, it's also recommended during pregnancy, especially for labor. So if you're trying to get that labor started, maybe just try some raspberry leaf tea. But the thing for the period is that you should start it a week before your period. So you can take 1 cup of tea a day. And on your period, from your period, for the days of your period, you can take up to 2 cups per day. So you should try it. Third on the list is migraine. People who suffer from a lot of migraine that have actually needed preventive measures like medications that prevent your migraine. You could try riboflavin. You can take it alongside your other preventive medications, or you can take it on its own. You just find that it actually helps to improve, your migraine and reduce the frequency of migraine. Fourth, is it fourth now? Fourth on the list is for someone who is planning conception. So if you're someone who's trying to get pregnant, you should start taking your folic acid now, not when you get pregnant, not when you discover you've gotten pregnant during antenatal, before you get pregnant, because that reduces the risk of spinal bifida, that's spinal malformation. If you're someone who has a higher risk of getting this condition, your baby getting this condition, you should be on a higher dose of folic acid, so you should speak to your doctor. Another one is people who have frequent mouth sores. So if you have frequent mouth sores, evidence suggests that vitamin B12 can